whatever it is. I mean, there's no question right now. There's like, there's such like a lack of faith in healthcare. And it's one of the things that like sort of like in the zeitgeist, people are kind of like preaching. And I think probably like a lot of that came from COVID, and a lot of that came from sort of like everybody kind of like all of a sudden having healthcare be kind of like something that everybody was talking about. There's no such thing as like an atheist in a foxhole, right? It's like when people are dealing with cancer, they're not like, well, I heard on Rogan that like you do this or that. They're not like,
yes and no.
Is that true?
You'd be surprised.
Really?
You'd be surprised. People's convictions are pretty firmly held right now. We are at the early stage still of this kind of information overload, and no one has figured out exactly how to train people to process what comes in and how to develop thoughtful kind of internal algorithms for sorting out what is real and what's not. And I think as we go through, it's just an interesting idea. I also teach, right? Like I got to teach at the medical school, and I teach residents and teach students and fellows.
And you're actually in labs, actually
right.
figuring out what the like scientific method, right?
Right. And I think it's one of these things where, historically how we teach people was all about retention. How did you get tested your whole life? Yeah, it's like someone tells you something, and then it's how much of that did you retain and can hand back to somebody. Yeah. And now all of education has to shift to developing a way in which retention becomes far less valuable, but sort of analysis, prioritization, some sort of kind of methodology for taking what is, infinite data that's available to you and sorting out what should come to the top. And unfortunately, right now, it's about what feels good, right? It's like the data you want to come to the top comes to the top.
Super easy to find.
And that's, if you can find unlimited data and you can always just sort of take the one you like best, it fits with your worldview. And so with cancer, it's a big problem, right? Because you can go look up any of the cancers that I take care of, and you'll find somebody who's written something that says, walking 4 circles around a wood post in the desert of Nevada is going to cure cancer.
Right.
And we have people who say, like, I got to go try that first.
Yeah.
Like this really, but how you navigate that as a doctor is tough, right? Because there's some stuff that's just bat crazy.
Right.
Right. And like, you can't, if time is of the essence, and they're going to go and they say, like, I read somewhere I've got to spend 3 months walking around that wood post in Nevada.